5 proven habits that lower blood pressure naturally. The silent threat. Right now, as you watch this, approximately 1 in 3 adults around the world is living with a condition that is slowly, silently damaging their heart, their brain, and their kidneys. They're going to work, making dinner, laughing with friends, and most of them have absolutely no idea anything is wrong. High blood pressure or hypertension has no obvious symptoms. There's no pain, no sudden warning, no alarm that goes off. It works quietly, deep inside the body, eroding the very vessels that keep you alive. Over years, unmanaged high blood pressure causes arteries to harden and narrow. It forces the heart to pump with increasing effort, wearing it down over time. It strains the delicate filtering systems of the kidneys, and it dramatically raises the risk of heart attack, stroke, and organ failure. This is why doctors and researchers call it the silent killer. Not because it's rare. It's one of the most common chronic conditions on the planet, but because it does so much damage before anyone notices. But here's what makes this story different from most medical warnings you'll hear. This isn't a story about inevitability. It's a story about biology and how powerfully the body can respond when we give it the right conditions. Decades of clinical research now confirm what many doctors have long believed: that certain daily habits, practiced consistently, can meaningfully reduce blood pressure and dramatically improve heart health, even without medication. Today, we're going to explore 5 of those habits. Not vague lifestyle advice. 5 specific, science-backed behaviors that act directly on the biological systems responsible for controlling blood pressure. Let's begin. Habit 1. Move your body. For most of human history, movement wasn't something people had to schedule. It was simply part of life. Hunting, farming, building, walking miles each day without thinking about it. Modern life changed all of that. Today, the average office worker spends more than 9 hours a day sitting, in cars, at desks, on sofas, and while that shift in lifestyle has brought enormous convenience, it has come with a steep biological cost. When the body is physically inactive for extended periods, the cardiovascular system gradually becomes less efficient. The heart doesn't have to work hard, so it doesn't develop the capacity it needs. Blood vessels become less flexible. Metabolic processes slow down, and over time, blood pressure creeps upward. Here's what changes when you introduce regular physical activity. The heart is a muscle, and like all muscles, it responds to training. When you exercise consistently, the heart becomes stronger and more efficient. It pumps a greater volume of blood with each beat, which means it doesn't have to beat as hard or as fast to circulate blood through the body. That directly reduces the pressure pushing against your arterial walls. There's also a secondary effect. Exercise encourages blood vessels to produce more nitric oxide, a molecule that signals the vessel walls to relax and widen. This dilation lowers resistance in the arteries, creating more space for blood to flow, further reducing pressure. And you don't have to become an athlete to benefit. Moderate, consistent activity is enough. A 30-minute brisk walk 5 days a week. Cycling on weekends. Swimming. Even gardening or dancing can have measurable cardiovascular effects. Research consistently shows that regular aerobic exercise can reduce systolic blood pressure by 5 to 8 millimeters of mercury. That may sound modest, but in population studies, reductions of that size translate to significantly fewer heart attacks and strokes across millions of people. Movement is medicine, and it's one of the most accessible prescriptions in the world. Habit 2. Eat foods that support healthy blood vessels. Every single day, the food you eat is having a direct conversation with your blood vessels. The inner lining of your arteries, called the endothelium, is a living, dynamic surface just 1 cell thick. It regulates how blood flows, how vessels constrict and dilate, and how nutrients are exchanged. It is remarkably sensitive to what you eat. Diets high in ultra-processed foods, refined carbohydrates, excess sodium, and industrial seed oils promote systemic inflammation. That inflammation damages the endothelial lining. Over time, arteries become stiffer and less responsive. Blood has to push harder to get through, and blood pressure rises as a result. On the other hand, Diets rich in whole, minimally processed foods create the opposite effect. They deliver key nutrients that support the health and flexibility of blood vessels. Potassium, found in foods like bananas, sweet potatoes, spinach, and avocado, helps the kidneys flush excess sodium from the body and relaxes the walls of blood vessels. Magnesium, found in leafy greens, nuts, and legumes, supports proper muscle function in arterial walls. Dietary nitrates, found in beets and leafy greens, are converted to nitric oxide in the body, the same molecule we mentioned earlier that signals arteries to open up and relax. This is the science behind one of the most extensively studied dietary patterns for blood pressure, the DASH diet, short for Dietary Approaches to Stop Hypertension. Developed in the 1990s through a landmark clinical trial funded by the National Institutes of Health, the DASH approach emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting red meat, added sugar, and especially sodium. In clinical studies, the DASH diet has been shown to reduce systolic blood pressure by 8 to 14 millimeters of mercury, a result comparable to some blood pressure medications. The underlying principle is simple. The closer your diet is to whole, unprocessed food, the more you are feeding your blood vessels what they need to function as they were designed to. Habit 3. Maintain a healthy weight. Of all the lifestyle factors linked to blood pressure, body weight is one of the most powerful predictors, and one of the most modifiable. The connection is not simply about how you look. It's about the biological burden that excess weight places on the cardiovascular system. When the body carries more tissue, especially fat stored around the abdominal region, the heart must work harder to supply every cell with oxygen and nutrients. Blood volume increases, cardiac output increases, and the walls of blood vessels are under greater stress, simply from the sheer mechanical demands of a larger system. Excess fat, particularly visceral fat, the kind that accumulates around internal organs, also drives hormonal disruption. It promotes the release of inflammatory compounds that impair blood vessel function. It can activate the renin-angiotensin system, a hormonal pathway that regulates blood pressure, pushing it in the wrong direction. And it contributes to insulin resistance, which compounds the cardiovascular strain further. The encouraging data is this: even modest weight loss produces significant results. Research shows that losing just 5 to 10% of body weight, for a person weighing 200 pounds, that's just 10 to 20 pounds, can produce meaningful reductions in blood pressure. In some studies, the magnitude of that improvement has been comparable to the effect of a single antihypertensive medication. The most sustainable path to that outcome isn't extreme dieting. It's the gradual, compounding effect of the habits we're discussing in this video. Regular movement, better nutrition, consistent sleep, and lower stress. As the body's overall metabolic health improves, weight loss often follows, and blood pressure improves with it. Habit 4. Improve sleep. Sleep is perhaps the most underestimated variable in cardiovascular health. We tend to think of sleep as passive, simply the absence of wakefulness. But biologically, the sleeping body is anything but inactive. It is in a state of intensive repair and regulation. During the deepest phases of sleep, heart rate slows. Blood pressure naturally drops by 10 to 20%, a phenomenon called nocturnal dipping. This nightly reduction gives the heart and arterial walls a period of genuine rest. It allows the body to clear metabolic waste, regulate hormones, and reset the nervous system. When sleep is consistently short, fragmented, or poor in quality, that restorative window disappears. Stress hormones, particularly cortisol and adrenaline, remain elevated. The sympathetic nervous system stays activated. The body remains in a low-grade state of physiological alert. And sustained low-grade stress response means sustained elevation in blood pressure. One specific sleep disorder has an especially strong link to hypertension: obstructive sleep apnea. In sleep apnea, the airway repeatedly collapses during sleep, briefly cutting off oxygen. Each episode triggers a stress response, a surge of adrenaline, a spike in heart rate, a jump in blood pressure. For someone experiencing dozens or even hundreds of these episodes per night, the cumulative cardiovascular damage is significant. Research estimates that sleep apnea is present in a large proportion of people with treatment-resistant hypertension, cases where blood pressure remains high despite medication. Treating the sleep disorder often brings the blood pressure back under control. For most adults, 7 to 9 hours of quality sleep per night is not a luxury. For the cardiovascular system, it's a biological necessity. Habit 5. Manage stress. To understand how stress affects blood pressure, you need to understand one of the oldest survival systems in the human body: the fight-or-flight response. When the brain perceives a threat, whether it's a predator in the ancient world or a difficult conversation in the modern one, it triggers an immediate cascade of physiological changes. Adrenaline floods the bloodstream. The heart rate accelerates. Blood vessels constrict to redirect blood toward the muscles. Blood pressure surges. In short bursts, this response is life-saving. It sharpens focus, increases strength, and prepares the body for action. But the human nervous system did not evolve to manage the kind of chronic, low-level stress that defines modern life. Financial pressure, work demands, social conflict, information overload. These threats don't resolve in seconds, they persist for months or years. And the biological stress response, designed for sprint, is not designed to run as a marathon. When the body stays in a prolonged state of activation, cortisol levels remain chronically elevated. This hormone, in sustained high levels, promotes inflammation, disrupts sleep, increases appetite for high-calorie foods, and, critically, keeps blood pressure elevated. The good news is that the nervous system is highly responsive to intervention. Practices that activate the parasympathetic nervous system, sometimes called the rest and digest system, directly counteract the stress response. Deep, slow breathing, meditation, yoga, time spent in nature, even just a few minutes of intentional quiet during a busy day. These practices have been shown in clinical studies to reduce cortisol levels, lower heart rate, and produce measurable reductions in blood pressure. They're not soft wellness trends. They're evidence-based interventions that work on the same biological systems as some medications. Managing stress is not about eliminating difficulty from life. It's about developing the capacity to return to calm. Small habits, big impact. High blood pressure rarely appears overnight. It builds slowly, shaped by years of small choices, biological gradients, and compounding physiological changes. The encouraging truth is that improvement follows the same slow, cumulative path. Movement strengthens the heart and opens the vessels. Whole foods nourish the endothelium and regulate fluid balance. A healthy weight reduces the mechanical and hormonal burden on the cardiovascular system. Quality sleep gives the heart nightly relief and resets the hormonal landscape. And managing stress quiets the nervous system that drives so much of the damage. These 5 habits don't work in isolation, they reinforce each other. Better sleep makes stress easier to manage. Lower stress makes healthier food choices more likely. Movement improves both sleep quality and metabolic health. Each piece connects to the others. If you or someone you care about is living with high blood pressure, the most important thing to understand is this: the trajectory is not fixed. The body is adaptable, and it responds to the environment you create for it. Managing blood pressure is rarely about a single dramatic change. It's about building a pattern of daily choices that support the heart over time. And sometimes those choices, made consistently over months and years, can fundamentally change the future of someone's health. Because the quiet habits done in private shape the outcomes that no one sees coming. If this video gave you something valuable, consider sharing it with someone who might need it, and subscribe for more science-based insights into how the human body works and how to help it thrive.